you're talking a little bit about the strategies that you might implement to get informed care or even to just get a care provider to believe you. But I'm
Yeah.
wondering, I know you have had some really effective care providers or you've forged relationships with care providers. So can you talk a little bit about what those medical professionals did to instill that trust in you?
The first grouping of strategies is being, a COVID informed provider. So, my most disabling disability was directly caused by COVID. So, of course, I'm going to be extremely concerned about, potential COVID exposure. When providers mask, that is a direct indicator that they, are caring for their patients, doing no harm, hopefully, and, believing in science and public health. So that, is one clear indicator. Also, in person using things like ventilation, those sorts of things. There's lots of ways to try to keep cleaner air. And so that's a big one for me. But also as someone who's very at risk for COVID and has little to no energy, telehealth is extremely important for me. That's very helpful to have that flexibility. Also, just like I know when I'm being listened to, like hearing things like, I hear you, I believe you, I'm sorry you've had to go through all of this. That is just very affirming to hear. And also, something I really respect about my primary care provider is that she'll be upfront about what she doesn't know. So, she'll say, like, I'll be like, oh, any new research or anything, which, I'm also looking into, but I want to know her perspective.
You're reading the same journals.
Yeah. But, I don't have a medical background. So, and she'll say, like, I'm so sorry, like, there's nothing new right now. And I would rather have that honest answer than, than not, like, and have someone pretend that they know things that, aren't going to be helpful for me or things like that. So that is really helpful. And like, also just the, I might not have the answers right now, but I'm going to work with you. Like that focus on teamwork, I think is very important, especially for people who, have what are probably going to be lifelong disabilities and chronic illnesses. Like to create that sort of trusting team, I think is really important. And like, then thinking about the energy piece, like it's too much for me to constantly be finding new doctors. So like, it's important to try to find someone that's going to be in it with you for at least a while, which there are a lot of things go into that about, location, insurance, finances, everything. But, that's a big point. And then probably the last thing is like, willing to try new things. And, I'm too sick really to try a lot of new things, but there are some like lower risk supplements and those sorts of things that can be helpful. And, I have found limited success. I appreciate providers kind of willing to look into that and maybe think outside the box a little, especially because there are no FDA approved treatments or any cure for long COVID or associated conditions like ME. Yeah, kind of long-winded answer, but I think like those are ways that providers like tell me that maybe I'm going to be able to trust them or,
Because I think you've talked a lot about how you are in a team with your medical team. Like you are a member of that team yourself.
Mhm.
So what does that partnership look like? And what lessons can other medical providers take away from that?
Yeah, I mean, like I've mentioned, just the way that conversations are phrased about like showing clear active listening is a big part. I think too, so far, like, so this isn't my experience, but I do know a lot of people that bring like a caregiver, a family member, or a friend to appointments with them. And I think sometimes providers like aren't really sure what to do in that scenario and may kind of fall into speaking to like the caregiver, for example, as opposed to the patient. And that can be very infantilizing and invalidating. So I think that it's very important to keep the main focus on the patient. I think that like level of respect is very important, and connection. So I think that's part of kind of like that active listening. And like for me, obviously I've mentioned how important it is to be COVID informed, but like phrasings like, it's very triggering and off-putting to me when providers refer to the pandemic in the past tense, because people like me and you with chronic illnesses and disabilities, like, we're right in the thick of it. Like, arguably things are worse for me than they ever have been, because I'm just getting sicker and sicker, and the world is less and less accessible to me as less people mask.
Mhm.
And
'Cause
so,
COVID's still here. It's just
right,
now fewer people are wearing masks.
right. So that's a big part of it for me. Um, yeah, and just like what I've mentioned about understanding energy limiting disabilities and trying to provide accommodations.
Well, Casey, I'll say I'm so honored to be your friend. I know I say this all the time, but it just means the world to me that I know you have so many energy limitations, and it is just the highest honor that you invest your energy in our friendship.
Oh, thank you so much. Yeah, I think, like I said, it's so comforting to have, such a close friend who really knows what I'm going through, and, is so empathetic. And I think that makes our friendship so much more meaningful, like I've said, because we do have these constraints. And so the time that we spend together is like extra special. So I'm very grateful to you. Love you.
Love you.